Prenatal development of the fetus. Simple notes for nursing students. Stages of prenatal development. The development of a fetus happens in 3 stages. 1. Ovular germinal period, first 2 weeks after ovulation. This stage starts when the egg ovum is fertilized by sperm. Even after fertilization, the egg is still called an ovum. The fertilized egg undergoes rapid cell division and implants in the uterus. 2. Embryonic period, 3rd to 8th week post-conception. The embryo starts forming important body structures. By the 8th week, the embryo is about 4 mm in length. Major organs and body systems, including the heart, brain, and limbs, start developing. 3. Fetal period, 9th week to birth. The baby is now called a fetus. Growth and maturation of organs continue. After the 8th week, the baby's age is calculated based on menstrual age, weeks from the last menstrual period instead of embryonic age. Fetal length measurement. Early weeks. Length is measured from head to tailbone, crown rump length, CRL. After the 20th week, length is measured from head to heel, crown heel length, CHL. Formula for calculating fetal length. 1. First 5 months. Square the number of lunar months. Example, at 3 months right pointing arrow 3 times 3 equals 9 centimeters. 2. After 5 months. Multiply the lunar month by 5. Example, at 6 months right pointing arrow 6 times 5 equals 30 centimeters. Important events in embryonic and fetal development. Gestational age versus post-conception age. Gestational age equals time from the first day of the last menstrual period, LMP. Post-conception age equals time from actual fertilization, which is 2 weeks less than gestational age. Gestational age calculation formula. In the first trimester, CRL plus 6.5 equals gestational age weeks. Fetal growth. Fetal growth happens in 3 phases. 1. Cellular hyperplasia, rapid increase in cell number. 2. Hyperplasia plus hypertrophy, cells increase in size and number. 3. Hypertrophy, cells mainly grow in size. Factors affecting fetal growth. Genetics, first half of pregnancy. Environment, second half of pregnancy. Physiological factors. Race, European babies are heavier than Indian babies. Sex, male babies generally weigh more than female babies. Parental factors, taller and heavier mothers have heavier babies. Birth order, second baby is usually heavier than the first. Socioeconomic status, wealthier families tend to have heavier babies. Hormonal control, IGF-1 insulin-like growth factor 1 insulin, and other growth hormones regulate growth. Growth hormone is more important for post-birth growth. Average fetal weight at birth in India, 2.5 kilograms 3.5 kilograms. Certain medical conditions can negatively affect fetal growth. Principal events of embryonic and fetal development. Days 14 to 21 post-conception. Notochord develops. Ectoderm thickens to form neural plate and neural folds. Days 21 to 28 post-conception. Neural folds fuse to form neural tube. 4 primitive cardiac chambers. First heartbeats on D21. Weeks 4 to 6 post-conception. 14 to 15 embryo. Optic vesicles appear. Complete neural tube closure. D30. Limb buds appear. Formation of face. Weeks 6 to 8 post-conception. 15 to 30 embryo. All major structures form. Complete ventricular septum. D46. Recognizably human. Weeks 8 to 12 post-conception. 30 to 60 embryo. External genitalia develop. Weeks 20. Skin is covered with lanugo. Vernix caseosa is present. Weeks 28. Testes descend to the internal inguinal ring. Baby is viable. Weeks 36. One testicle usually descends into the scrotum. Lanugo tends to disappear. Weeks 40. Both the testicles descend into the scrotum. Nails project beyond the fingertips. Posterior fontanelle is closed. Fetal physiology. Fetal nutrition. The fetus receives nutrition in 3 stages. 1. Absorption, early stage, right after fertilization. The embryo uses stored nutrients inside the cytoplasm of the egg. A small amount of extra nutrition comes from secretions in the fallopian tube and uterus. 2. Histotrophic transfer, before placenta forms. Before the placenta is fully functional, nutrients are absorbed from the mother's uterine lining, decidua. Later, nutrients come from stagnant maternal blood in tiny spaces formed by the placenta, trophoblastic lacunae. 3. Hematotrophic transfer, after placenta forms. After the 3rd week, the fetus gets nutrients directly from the mother's blood through the placenta. This continues until birth. Nutrient transfer in importance. The fetus takes whatever it needs from the mother, even if it reduces the mother's own nutrient levels. Nutrient transfer is not evenly distributed throughout pregnancy. 2/3 of total calcium, 3/5 of total protein, and 4/5 of total iron are taken in the last 3 months. This is why preterm babies have lower nutrient reserves. The fetus stores extra iron to prepare for the low iron content in breast milk after birth. Fetal blood and hematopoiesis. Blood formation. 1. Sites of blood formation. 14 days. Blood formation starts in the yolk sac. 10 weeks. The liver becomes the main site of blood production. Later, the spleen and bone marrow also start producing blood cells. Near birth, bone marrow is the major site of red blood cell (RBC) production. 2. Fetal hemoglobin (HbF) versus adult hemoglobin (HbA). Early fetal hemoglobin, HB Gower 1, HB Gower 2, and HB Portland. From 24 weeks onward, adult hemoglobin (HbA) starts forming. At birth, 75–80% of hemoglobin is still fetal type HbF. HbF has a higher oxygen affinity than adult hemoglobin, helping the fetus get oxygen from the mother. By 6 to 12 months after birth, HbF is completely replaced by HbA. 3. Fetal blood characteristics. RBC count, 5 to 6 million cum. Hemoglobin, 16.5–18.5 grams %. Reticulocytes, 5%. Lifespan of fetal RBC, 80 days shorter than adults. Rh factor is present in fetal blood from 38 days after conception. 4. Iron and vitamins in cord blood. Cord blood has higher levels of iron, ferritin, vitamin B12, and folic acid than maternal blood. Fetal immunity, leukocytes and defense system. White blood cells WBCs appear after 2 months of gestation. WBC count at birth, 15,000 20,000 cum. Thymus and spleen produce lymphocytes, which help in antibody formation. The fetus rarely produces antibodies due to the sterile environment in the womb. Maternal Ig immunoglobulin G crosses the placenta from 12 weeks onwards, providing passive immunity. At birth, fetal Ig levels are 10% higher than maternal levels. IgM is produced by the fetus and helps in detecting intrauterine infections. IgA is produced only after birth to protect against infections. Urinary system. By the end of the first trimester, fetal kidneys start producing urine. Near birth, urine production reaches 650 milliliters per day. The kidneys help regulate amniotic fluid levels but are not essential for survival in the womb. Oligohydramnios, low amniotic fluid, may indicate kidney problems. Skin development. 16 weeks. Fine, colorless lanugo hair appears, mostly disappears near birth. 20 weeks. Sebaceous glands start forming. Sweat glands develop later. Vernix caseosa, white protective layer on the skin, forms from sebaceous gland secretions mixed with exfoliated skin cells. Before 20 weeks, the skin is thin and allows fluids to pass into the amniotic fluid. Gastrointestinal system. 10 to 12 weeks. The fetus starts swallowing amniotic fluid. 20 weeks. Meconium, first stool, begins forming. At birth, meconium is present throughout the intestines. Meconium composition. Hepatic waste, swallowed lanugo hair, exfoliated skin cells, intestinal juices, and mucus. Greenish-black color due to bile pigments biliverdin. In fetal distress, low oxygen, meconium can be released into amniotic fluid, causing complications. Respiratory system. Early pregnancy. Lungs are solid. 24 weeks. Surfactant production begins. 28 weeks. Alveoli expand, lined by cuboidal epithelium. Surfactant phospholipids, lecithin and phosphatidyl-glycerol, is produced by type 2 alveolar cells to reduce surface tension and help with lung expansion after birth. L/S ratio of 2:1 in amniotic fluid indicates lung maturity. Fetal breathing movements (FBM) start at 11 weeks but are irregular until 20 weeks. FBM is affected by maternal conditions. Reduced by low oxygen, hypoxia, smoking. Increased by high blood sugar, hyperglycemia. Fetal hormones, endocrinology. 10 weeks. The pituitary gland produces growth hormone, ACTH, prolactin, TSH, and gonadotropins. 12 weeks. The posterior pituitary secretes vasopressin, ADH, and oxytocin. Adrenal glands. Reticular zone produces estriol precursor, cortisol, and DHEA, absent in anencephaly. Adrenal medulla produces small amounts of catecholamines, stress hormones. 11 weeks. The thyroid gland starts making thyroxine, T4. Male reproductive system. Testes produce testosterone, guiding male genital development. 12 weeks. Fetal pancreas starts making insulin, and glucagon is secreted by 8 weeks. Summary. Fetal development is a complex, well-regulated process that ensures the baby gets proper nutrients, oxygen, immunity, and hormones. The placenta plays a crucial role in transferring nutrients, oxygen, and maternal antibodies. Surfactant is key for lung function after birth, and hormones regulate fetal growth and metabolism.